Hello again, and this is the last part of the malabsorption syndrome, and I just talked about the approach to the patients with the malabsorption. In every and each disease to diagnose, we just go to the detailed patient history, like if the patient has lactose intolerance or if the patient has the inflammatory diseases or the patient has some infectious diseases. So we go to the thoroughly the history of the patient. And when then we see the blood test, the CBC, complete blood count, we see that if there is consequences of the malabsorption, like in the blood test, we can see that there is anemia to the patient, and because there is less vitamin B12 and ferritin levels, so we can see the patients are anemic. And to confirm that if the patient has malabsorption or not, we see that with stool fats, like I just talked in the symptoms in the section, that there are more than 7 gram per day of the stool fat when the patient had the malabsorption. And to diagnose that, if the patient had the inflammation to the intestine, we confirm with the endoscopy, X-rays, that is contrast, and other tests we see the CBC and the RBCs indices in the blood test. So when we do the endoscopy of the patients of the small intestine, we see that there's inflammation in the small bowel, due to which there's less absorption of the nutrients. And first of all, we see and the clinical findings, if the patient has diarrhea, that is chronic diarrhea, which suggests malabsorption, steatorrhea, if the patient is paler or not, and we see the weight loss in the patient. And who do the screening test, the CBC with the RBCs indices. If the patient has macrocytic or macrocytic anemia, we go for the calcium, magnesium, albumin, and cholesterol, and that the criteria for that was see the Sudan 3 staining to collect the 72-hour stool. And if the patient is anemic, we further go these things like ferritin levels, vitamin B2, and folate levels. And if the screening tests are positive, we further go for the other causes, that what is the etiology. If there is screening test positivity, we see that we go to the mucosal disease. To confirm the mucosal disease, we do the esophagogastroduodenal endoscopy, and for the pancreatic insufficiency, we do the abdominal X-ray, uh, and serum trypsinogen or fecal elastase. If they are disorder, we see that it is due to the pancreatic insufficiency, uh, because of which the nutrients are not being absorbed. Mostly, we see the steatorrhea in the pancreatic insufficiency, and vitamin B12 deficiency. We do confirm by chilling test, and at the end, we see that if there is overgrowth of bacteria, we do the breath test, and again the esophagogastroduodenal endoscopy. Like we see that if there is intact mucosa or not, or if there is uh, more growth of bacteria in the intestine, then the nutrients are not being absorbed well. And what if the negative tests, screening tests, are not being suggestive for the malabsorption? If we again suspect that, okay, there's it may be the malabsorption, we see and collect the 72 hours to, if there is more than 70 gram per day steatorrhea, we go further for the screenings, we see the mucosa or pancreatitis, if there is insufficiency of the pancreatic enzymes, and other things. Okay, if the screening tests are negative, and we don't do further testing, because it says that there's no malabsorption, because all the screening tests, stool is normal, there's no fats in the stool, the CBC is normal, other ions like calcium, magnesium, albumin, these all are normal, then we don't need further testing to confirm the malabsorption. So if there's positive screenings, we do the screening, and there's no positive screening, what we do further, is the T-xylose absorption test. This absorption test may help us to rule out if there is pancreatic insufficiency, or it may due to the deficiency in the it may be due to the mucosal disease. If the xylose absorption test is abnormal, we see that there is uh, mucosal disease. Mucosal disease, like it may be the atrophy of the villi, or it may be due to the bacterial overgrowth. So we do the esophagogastroduodenoscopy to confirm. Well, if this xylose absorption test is normal, we see that there's no problem in the mucosa. Mucosa is normal, but there is deficiency in the pancreas. Then we do the abdominal X-ray. We check the level of serum trypsinogen, and we go for the fecal elastase to know that there is pancreatic insufficiency, because of which there is no absorption of the fats, and the part of the diagnosis is at the end. Thank you, and hope I will record other lectures. And okay, thank you.